Hi, my name is Sherzel. I'm 23 years old and I'm from the Bahamas. And I did my bachelor's degree in healthcare policy and public health in the United States. A part of that bachelor's had me going to Copenhagen as an exchange student. And I was able to travel around Europe and I thought I could do my master's in Amsterdam. And I ended up in Amsterdam doing a master's in global health at the VU as a part of the VU Fellowship Program. And in conducting this master's, in order to complete my thesis, I got in contact with Houston Asbrook and Tobias Rinkeduit, both of whom work at the Amsterdam Health and Technology Institute, or ahti. And one of their aims is to connect existing talent in Amsterdam in order to improve healthcare. And they were able to connect me with Bianca Berman of the AMC, as well as Janet Becker of Duke University in North Carolina in the United States. And I worked with these two people in a project in evaluating an intervention called Transitional Care Bridge. And this formed my master, and I've actually been the first master's student supported by the ahti Institute. And I was able to do a good job. I got a 9. And so my actual thesis focused on the Transitional Care Bridge intervention, which was implemented in 3 hospitals in the Netherlands. And the Transitional Care Bridge intervention, the whole focus of it is to improve the transition of care of elderly patients and vulnerable patients from acute hospital care to home care or into informal care settings. And so the intervention focused on community care nurses who would help to facilitate this transfer of care. And what I wanted to do was evaluate this program both on the economic side as well on its potential for implementation. And so this process involved a literature review looking at methodological challenges in evaluating complex interventions. And the results of that research led to a comprehensive economic evaluation of the Transitional Care Bridge. And what we actually found was that the Transitional Care Bridge was moderately cost effective depending on different willingness to pay levels. But what was most interesting to us was the potential barriers to implementation. So for example, one of the barriers that we were able to come up with was the fact that communication oftentimes is difficult between healthcare providers. And so trying to find ways to increase and foster the communication between healthcare providers can increase the potential for the Transitional Care Bridge to be implemented in different settings. And also we looked at context dependency. So different hospitals in different care settings have different levels of capacity. And so it's important to be able to pay attention to the levels of capacity of each healthcare setting when you consider implementing any intervention. So those were our main findings. And hopefully these will help with the next steps in looking at the Transitional Care Bridge intervention. And this is really useful for an organization such as ahti, which focuses on improving healthcare on the whole. And for my future, perhaps a PhD later down the line, but right now I want to work more with healthcare efficiency and see where that leads.